Hello, everyone, and welcome to OPJ Hub. I'm so excited today. I'm Dr. OPJ. Kindly share this video to your loved ones and friends so we can all learn together. I want to share very important stuff with you today. I want you to share this video as well to your loved ones and friends. So let's begin. I'm going to read some of the questions here, and then if you have a question, you can drop it in the comment section so we can all learn together. Okay, so let's begin. The first question is, Dr. OPJ, what exactly is chest pain? Okay, so chest pain, I believe when we say chest pain, we are actually trying to say this side of your body. That's from your neck, right from your neck, lower part of your neck here, to let's say the upper part of your abdomen. This a whole area is called the chest. Okay, so any pain that you can feel at any point in this area is what we call the chest pain. Please, do you get it? Yeah. So I want to take it again. I'm saying that chest pain is any pain or any discomfort that you feel around this area, below your neck to somewhere around your upper abdomen. So from this area all is what we call chest pain. Okay. Now, there's something very important I think you need to know, that these chest pain have different characteristics that we are looking for. They can tell us, they can give us a clue of what medical condition someone is having. Okay, whether the problem is from just the muscles here on the chest, or the vessels, or the nerves, or the organs within the chest, these chest regions. All right, so it depends on the kind of chest pain the person is presenting with. Do you get it? Uh-huh. So let's look at the next question. The next question says, does every chest pain means heart disease? Okay, so I want to answer the question. The question says, does every chest pain means a heart disease? No, no. So let's take a look at the chest region as I mentioned. So we have very important, at least we have some very important organs within the chest. Then let's look at them. So we have the heart, number one. We can talk about the lungs, the left and right lungs. We also have the esophagus passing through that same place. Then we have the muscles of the chest. Okay, the pectoralis major muscles over here. Then we also do have nerves that innervate the muscles there. We have some blood vessels there as well. So, and then all these things or all these structures that are within the chest are very important. So when someone has a chest pain, it does not mean that the person has a heart disease alone. It could be that the problem is from just the muscles, okay, or even the bones, I mean the ribs. You know, we have the rib cage here. So there could be a problem just on the ribs, or the problem is coming from the esophagus. All right, the esophagus passes through the neck, through the chest region, and part of it goes into the stomach. So there can be a problem within the esophagus, what we call esophagitis, or maybe GERD, okay, a reflux disease. And yeah, so those are some of the things that can happen. Then you can also have the heart itself having the disease, which will then show as chest pain. And then you can have the lungs also, when it's also having a disease, can also present as chest pain. So the question has been answered. Chest pain does not mean that you have a problem with your heart. However, there are some characteristics we are looking out for in the chest pain that will put into our mind or heighten our suspicion they're actually having a heart condition. All right, let's look at the next question. It says, how do I know chest pain is from the heart? All right, so we are going to look at, is it how do you know that chest pain is from the heart? Okay, so let's look at it. So there's one particular chest pain of the heart that we are so careful or mindful of, which is what we call the myocardial infarction. So with the myocardial infarction, or what people would term as heart attack, okay, what we are so mindful is, now this particular one, the chest pain happens centrally. It's like an elephant is sitting on the chest. The person feels some chest tightening, heavy chest tightening, all right? And then the chest pain, sometimes at the central part, moves to the left side of his body. Now, when I say left side, I mean the left jaw. Okay, so depending on how you're looking at me, the left jaw. And it also moves to the left arm, all right, or the left side. So any of this is that of the chest, that particular chest we are talking about. So it's sudden on onset, very piercing, very troubling, and sometimes they describe it as an elephant sitting on their chest, tightening them, and it radiates to the neck, the left jaw, okay, or the left arm, or sometimes the left back. So it depends on how it's presented. So that's how, and then the severity is, they can score it in terms of pain, like 10 over 10, 9 over 10, or 8 over 10. So that's what we're actually looking for. But then people with diabetes or kidney disease may not typically present with what we call the central chest pain, which radiates to the left side of the body, like the left jaw, the left neck, and then the left arm. Rather, they can just have abdominal pain. They can have abdominal pain, and then they may not even show the symptoms of chest pain radiating to this side of the arm and other stuff. No, but then they are having myocardial infarction, which is a heart disease. Do you get it? So that is one of the things we are so concerned about. So people with diabetes, kidney disease may usually not show that typical symptoms of chest pain, which radiate to their left side. However, they can just have only abdominal pain. Meanwhile, there's a problem with the heart. Do you get it? Yeah, so that's basically what we're looking at for. Let's see the next one. Yes. Can a heart attack feel like heartburns? Yes. Yes. So sometimes a heart attack can feel like heartburns. Like, heartburns usually when it's found in people who are having GERD, or what we call gastroesophageal reflux disease, or gastritis, or esophagitis. That's infection of the esophagus, or infection of the stomach, or a condition where the gas inside the stomach comes out, trying to purge out. So heart disease can also present with some of this. But even before I even move on, the condition I was talking about earlier on about cardiac infarction, with the chest pain moving to the left side of the body, one of the things that also is very classic for these people is that they sweat, and they sweat a lot, diaphoresis, and they sometimes have difficulty breathing, and some of them may have difficulty in terms of they feel very anxious, like nauseous. So they feel like vomiting. So these are some of the characteristics of the myocardial infarction I mentioned earlier. So just to add up, heart disease can present as heartburns or the indigestion. So just be mindful of any indigestion or heartburn you have. May be underlying cause may be from heart disease. However, it does not also mean that if you have indigestion or burns, it's actually a heart disease. All right. So let's look at this one. Okay, it says that what's the difference between heartburns and okay and heart pains? Okay, okay. So there's no a clear-cut difference between the heartburns and heart pains, but usually with the heartburns, the person usually feels it at this part of his chest. Okay, and sometimes there will be that nauseous and burning sensation in this throat, like from the throat downwards to the esophagus. That's when you feel like there is a burning sensation over there. And sometimes it's when they finish eating, or they're about eating. That's when they feel that heart pains. But for the heart pain, it's, we talk about it as a myocardial infarction, where they will have the chest pain, which radiates to the shoulders, left jaw, and left arm, and usually associated with nausea and vomiting. And usually, you don't get better, even if you lean forward, you don't get better. But with the heart pains, sometimes when you lean forward, it becomes better. So that's the difference between heart pains and then the. So let me take it again for you to understand. So what I'm trying to say is that the heart pains and the heart pain, one of the things you need to identify or differentiate them from each other is that heart pains, usually you feel it at your throat area down to your esophagus, like a burning sensation, okay? And usually the pain becomes better when you lean forward. Okay, and but with the heart pains, or what we call the myocardial infarction, the pain is very severe, and the chest pain is sometimes localized centrally. It feels like an elephant on the chest, and then it moves to the left side of your body, specifically your left jaw or the left part of your neck or the left arm, and it is associated with nausea and also sweating. Okay, so anytime you see any of these things, you should be mindful that you are having a heart condition and not necessarily heartburn. And heartburn can usually be from GIT, from the stomach related, while the heart pain from cardiovascular, that's the heart related. So take note of that. All right. There's a next question here. Let's see. It says that, can anxiety cause chest pain? Yes, yes, yes. So I think one of the things I did not add to the chest pain, I said cardiovascular cause can cause chest pain from the heart. Okay. We can have musculoskeletal problem can cause chest pain, like from the muscles of the chest and the skeletons, or let's say the ribs, can cause chest pain. The respiratory system, from the lungs, the trachea, and all those kind of stuff, structures of the lungs can also cause chest pain. Then we talk about the GIT system, the esophagus, gastro, uh, esophageal reflux disease, all of them can also cause chest pain. Excuse me. Then, not forgetting the nerves. So when there's a nerve injury, also can cause chest pain. Then anxiety can also cause chest pain. All right, so that's psychological, can also cause chest pain. So it's not always that when someone says, I have chest pain, I have chest pain, that means that he has heart disease. Okay, so it's not always that someone says, I have chest pain, I have chest pain, I'm dying. That means that the person is having a heart disease. For all you know, it's as a result of anxiety. The person is anxious. Probably maybe he has an upcoming exams and he has not yet prepared adequately. So because of the anxiousness he or she is having, is now having the chest pain, which is not related to anything of the heart or the lungs or the esophagus or any other thing, just because he or she is anxious. So that's one of the things you need to put at the back of your mind. Okay. So that one is asking, what does chest pain that gets worse when I breathe means? Okay. So it's not automatically that, okay, it gets worse. So it's actually chest muscle pain or something. It could be, as I said, there will be underlying causes. So we have to ask you furthermore to be sure of what chest pain you are having so we don't misdiagnose you. Do you get it? So it's very important. So it's very important that anytime you meet your doctor or your doctor is asking you questions about your heart or about your chest pain, make sure you tell your doctor everything you think you know about it. Because what you tell your doctor is what the doctor will use to kind of give an informed decision on how to manage you. All right. So let's say you're having chest pain, you are coughing, and the cough started 3 days ago, and the cough has some yellowish stain um, color in your cough, productive, and it's just like 3 days ago with chest pain. I'll be thinking about pneumonia, either community acquired pneumonia what we mean is that this part of infection of the lungs was acquired in your community. Or we also have what we call the hospital-acquired pneumonia, meaning that this type of pneumonia or lung infection was acquired while you were at the hospital, And so basically that can be one of the things. Yeah. Now, another very important thing I would like you to know, a lot of people are not even mindful of that. You see that whenever you have a relative at the hospital, we have other family members or other relatives coming to the hospital, kind of do the rounds for the patient, and sometimes stay over, and so they are at the facility for a very long time. They can also develop what we call hospital-acquired pneumonia. That means that they can have infection of the lungs. So the fact that they are caring for someone at the hospital does not mean that they are not exposed to some of these microorganisms in the air, and that eventually cause them to also have infections of the lung, which can be what we call the hospital-acquired pneumonia. So that's one of the things I think I want to draw your attention on. So anytime you are with your relatives at the